Integral eye movement therapy started as a simple technique to take care of troublesome memories and subsequently the unpleasant feelings that people experience from time to time. From that, it has now evolved to a 2-day practitioner workshop with 2 days advanced course, wherein we are looking at the kinesthetics, which are feelings and emotions, along with the memories, studying the structure of the brain, and moving on to the identity, which is our way of being. Further on, we get into the physiological state accessing cues, which is how body and mind are one system. Now, with all of the evolution which is still happening for IEMT, its trainers, participants, and the developer himself, who is Andy Austin, it has been seen that something that started as a simple modality to address unpleasant feelings is now being used in a lot of different domains. From physical aches and pains to skin disorders, including psoriasis, to all the unpleasant feelings, emotions, memories, identity, which is what we spoke about, how a state or a mood can be locked in the body, how to dismantle that. Along with that, looking at inner child issues. If there is a part of you that is still viewing the world or an aspect of the world as a 5-year-old, how does that age progression happen? And that part comes to this part, which is your current age, contributing to the wholeness of the individual. It is also looking at setting boundaries. So the emotional wisdom or the emotional quotient that Daniel Goleman and a lot of other leaders are talking about in the world is coming about with the work of IEMT. Insomnia is getting treated. People's chronic issues are going away. Trauma is Patients with traumatic experiences are finding relief with the technique of integral eye movement. Something which started as absolutely basic is now evolving into very different and varied wide range of applications that it is coming to. And you know what, I must confess, a lot of times my participants come back and tell me that, hey, you know what, just this is what I used IEMT for and I got a result. For example, IBS, irritable bowel syndrome, which according to research about 45% of the world population experiences. I have had a lot of participants come back to me and tell me that their IBS has disappeared after doing IEMT. And by the way, they did not directly work on their IBS. They were working on some other feelings, and as a result, that got cured. This is one of the things that we are seeing with IEMT. You may not be addressing it directly, but a beautiful side you may not be addressing it directly, but a beautiful side effect, rather a beautiful side benefit comes as a lot of issues going away. This is what IEMT is so far and evolving. To know more, check out the full presentation that comes right at this point.